Hi, I'm Jocelyn Chapman, a GynOnc oncologist at UCSF, and I'm happy to present a little bit of research to you folks today. I understand that there's been interest in understanding a little bit more about some of the research that's going on in our division. And this project that I'll talk to you about today is about ways that we're trying to detect early ovarian cancer and how the molecular understanding of this cancer provides an opportunity for early detection. As many of us know, ovarian cancer is unfortunately often diagnosed at stage 3 and stage 4 when it's less likely to be cured, quite a lot less likely, unfortunately. Of course, stage 1 and 2 cancer is a much more uncommon diagnosis stage, but it is more curable at this stage 1 and 2. What we want to do is invert this pyramid and diagnose many, many more women at stage 1 or even stage 2 when the disease is highly curable, and many fewer women at stage 3 and 4. One of the challenges is that ovarian cancer screening tests have to be very, very sensitive. This means that the test should have as few false positives as possible and not miss cancers. The reason for this is the consequence of a positive screening test is a surgery, which carries a lot of side effects. One of the reasons ovarian cancer is so challenging to detect early is because many of them start in the fallopian tube when they're truly microscopic. Microscopic cancer is not something that we can detect with an ultrasound or with a CT scan. And so there are becoming limitations really on our imaging studies to allow us to detect cancer when it's so microscopic and invisible to the eye. One of the tests that holds a lot of promise for early detection of cancer is something called a liquid biopsy. The idea about this is that cancer cells, as they grow, they're also dying at a certain fraction, and those dying cancer cells are releasing their abnormal DNA and their abnormal proteins into the circulation. And these abnormal proteins and DNA are distinct from our normal cells. And we can actually detect these from the liquid biopsy. We've demonstrated this many times over. The challenge is in detecting it in small enough quantities for very small cancers. And so this is where the opportunities for some of the technology are improving as in these last years. So the study that we've had open here for the last 2.5 to 3 years is called PRECISE. And the idea is that we consent patients who are undergoing surgery for an early diagnosis or concern for early cancer. What that oftentimes means is we don't know if they have cancer or not. All we know is that they might have an abnormality on their ovary or fallopian tube, or that they are at high risk of developing ovarian cancer. And so these are women who are invited to participate in this study, and they donate blood, and then we also evaluate their tissue. One of the big challenges, as I've mentioned, is that for very small microscopic cancers, the amount of abnormal DNA in circulation is very small. So the idea of detecting cancer or cancer DNA from very small fragments of DNA presents a big challenge. And this is where the idea of nullimers comes in. I've been collaborating with another lab here at UCSF, and they have discovered that these nullimers allow us to differentiate normal DNA from tumor DNA. In the course of their work, they've looked at some sequencing of many, many different kinds of cancer and have found that cancers themselves have unique patterns of nullimers. This graphic shows here that ovarian cancer, which I've highlighted in red, has a distinct pattern of nullimer expression compared to, say, kidney cancer or esophageal cancer. What this means is that the cancer process itself in the development of these abnormal DNA segments provides an opportunity for early detection tests, such as the one that we are currently working on. In partnership with many Bay Area companies, as well as UCLA and UC Davis, we're enrolling patients on this trial, and certainly hope in the coming months actually to be opening up this trial at UC San Diego and UC Irvine. So we have a UC consortium trial, which is very exciting. And in the coming years, hope to actually be able to have some results to present to you here and nationwide. Work like this cannot be done without a lot of collaborators, which I'm very, very lucky to have here at UCSF. Several laboratories are involved in this work with me. And then, of course, the funding is crucially important for these kind of high risk, high reward projects. And we're lucky to have contributions from some of my patients and other donors to help support this kind of work. I'll leave you with my favorite author's quote. Atul Gawande, if you haven't read him, highly recommend. He writes, "Better is not possible. It does not take genius. It takes diligence and a willingness to try." So we will continue fighting the good fight here at UCSF GynOncology. And thank you so much for your attention and for your support of our division.